You want to help me?
Look, I grew up with guns, okay? It's not safe to point them at people, so why don't you just put it away and then we could talk?
And who the hell are you?
Nurse Snyder, or Meg, if you want.
Okay, Nurse Snyder, since you want to help, why don't you tell me who killed my wife?
I'd be happy to answer any question you might have. Just put the gun away. It was just the elevator, sir. You need to calm down. You're scaring everybody. Look, you had a question about your wife, okay? I'll tell you anything you need to know. Just let these people go home, okay? They came here to donate blood. They can't help you.
Whoa, were you? Please, don't point that thing at me.
Great. Just listen and do what he says.
What's going on here?
The gentleman needs to ask me a few questions, okay? So just sit down and shut up, please.
Put your hands in the air where I can see you.
All right. All right.
Well, what is your wife's name?
Sarah.
That's a biblical name. It's old. It's beautiful.
Only she was very young.
I'm very sorry for your loss.
Very sorry for my loss? She was my wife. I've known her since 9th grade. That's 15 years.
You're lucky.
Lucky?
Somebody loved you for 15 years. That's rare. And I don't mean to minimize what's happened. I know you're angry and upset. But if Sarah died here at Memorial, it's only because they couldn't save her.
Save her? She wasn't even that sick. She came in here for an elective surgery, and now she's dead. That's messed up, lady. Somebody killed her. You maybe? How about you? Huh? You killed my wife? Hey, hey! What do you think you're doing? You do that again, I'm gonna hurt you.
You don't want to hurt anyone. You just want to find out what happened to your wife, and that's understandable. You love Sarah very much.
Don't you patronize me.
I'm not. But I have a lot of frightened people here, and you have a gun, and you're angry. And I'm just trying to find a peaceful way out of this for everyone. So why don't we all just take a breath, and you could give me some information, and I'll see what I could do. You said your wife's first name was Sarah. I need to know what her last name was.
Shaughnessy. I dropped her off this morning before the sun came up.
And she was admitted for elective surgery?
It was supposed to be a nothing procedure. She didn't even want me to stay. I had work. She said she'd be fine. So I went to the office. I called her right after the surgery, and everything was fine. I went and bought her flowers, pink carnations. It's the only flower that doesn't make her sneeze. And then I get a call from some doctor who tells me that she's gone. But there's nothing they can do. They didn't know what happened. She just crashed. How does that happen? A normal, healthy patient comes in for a minor surgery and just crashes and dies?
We have a code blue, room 7. Bring a crash cart stat. Come on, stay with me. Where's the cart?
You know what happened, don't you? Tell me what happened to my wife. I have a right to know what happened to my wife.
Yes, of course you do.
So let's hear it.
I could only tell you what I know.
You can all go.
Oh, God.
Except for her. How did she die?
I know an autopsy was ordered, which will give you a more complete answer, but all I know is that it appears that she went into anaphylactic shock during recovery. A code blue was issued. The team worked very hard on her. They did everything they could to bring her back. But the shock, on top of the surgery, she just couldn't make it.
But anaphylactic shock, that's usually caused by an allergic reaction, right?
That's often the case.
My wife was allergic to half the world. Did anyone bother to write down her history?
Of course they did. Her doctor would have discussed the case with her surgeon, who would have talked to the anesthesiologist, and when she arrived, they would have done a complete workup and listed all her allergies.
Right, so what went wrong?
I'm not sure. I don't know, maybe Sarah reacted to a new formulation of the drug that she was able to tolerate in the past, or maybe it was a combination of drugs. Or perhaps there was a medicine that she was allergic to that she forgot to mention to her doctor.
No, not possible. Sarah's had allergies since she was born. There's a whole list of medications that she couldn't take. She could rattle them off in 30 seconds flat. No, someone here made a mistake. But it wasn't Sarah.
Okay, look. Once the autopsy comes in...
There shouldn't have been an autopsy. This shouldn't have happened. She was allergic to everything. Even the bleach they put in paper. She couldn't use tissues. That's why I got her this linen handkerchief.
I'm so sorry.
When did your shift start?
I was asked to stay late to run the blood drive, so I've been here all day.
So you were here this morning?
Yes.
Did you see her?
Yes. I was one of the many people that pitched in when she coded.
You know who did this, don't you?